Let us now go to visual diagnosis of the back. The topic is spine bent forward, atrophy of muscles along the spine, and spots on back. Spine bent forward. Bending forward of the spine indicates a hereditary kidney essence deficiency, a deficiency of marrow, and a weakness of the governing vessel. A person who has kidney essence deficiency with weakness of the governing vessel will have a spine bent forward. They will also have a lower back ache, weakness of knees and legs, poor bone development in children, softening of the bones in adults, deafness, poor memory, loose teeth, hair falling out or premature graying of the hair, weakness of sexual activity, infertility, sterility, dizziness, tinnitus, and a normal colored tongue, and floating empty or leather pulse if kidney essence deficiency occurs against a background of kidney deficiency. A pale tongue and a deep weak pulse if it occurs against a background of kidney yang deficiency. If a person is born with such deformity of the spine, the condition is constitutional and there may not be any other symptoms. Atrophy of the muscles along the spine. Atrophy of the muscles along the spine indicates a spleen deficiency because the spleen nourishes all muscles, but it also has a direct influence on the spine. We use acupoints SI3, bladder 62, bladder 23, bladder 20, and DO 16. For spleen sheath deficiency, there will be atrophy of the muscles along the spine, weak muscles, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, slight depression, tendency to obesity, a pale tongue, and an empty pulse. Spots on the back. Spots on the back consisting of red papules may indicate invasion of wind heat with toxic heat in acute cases, or in chronic cases, damp heat or chi stagnation turning into heat. The diagnostic significance of such spots depends also on the location. If they are located in the upper part of the back, in the area between T1 and T6, they reflect a pathology of the lungs. If they are located in the central part of the back between T6 and T11, they reflect pathologies of the heart and liver. If they are located in the lower back below T11, they reflect a pathology of the kidneys. Pinhead pustules the size of millet grains usually indicate either damp heat or phlegm heat, and their significance also varies according to the location. If they are located on the upper back, they indicate a pathology of the greater yang channels, often of external origin. If they are located on the mid-back, they indicate heat or toxic heat, often from emotional problems. If they are located on the lower back, they usually indicate empty heat from kidney deficiency, often due to excessive sexual activity. As a summary, spots on the back between T1 and T6 indicate a lung pathology. Between T6 and T11 is heart and or liver pathology, and below T11 is kidney pathology. Here we can see a picture of what the red spots may look like. For wind heat with toxic heat, red papules on the upper back with acute onset will appear. There will be aversion to cold, fever, tongue with red points, and thick, sticky yellow coating. There will also be a floating and overflowing rapid pulse. For damp heat, there will be red papules or pustules on the back, lower back ache, feeling of heaviness of the back, sticky yellow tongue coating, slippery rapid pulse. And other symptoms and signs depend on the organ involved, which may be the stomach, spleen, or liver. For stagnant liver chi turned into heat, there will be red papules on the back that may be itchy and painful, hypochondrial or epigastric distension, slight feeling of oppression of the chest, irritability, premenstrual tension, irregular periods, premenstrual breast distension, feeling of a lump in the throat, feeling of heat, red face, thirst, propensity to outbursts of anger, heavy periods, tongue red on the sides, and a pulse that is wiry and slightly rapid. Thank you so much for your attention.